presentation for everyone today just to go over some of the things that were covered at the informational meeting at the start of the study in case anyone wasn't able to attend. But after that brief presentation, we will walk through how this meeting will be structured, and then I will turn it over to all the participants to share and take part in this community meeting. So I'll go ahead and share my screen and start our presentation. Alrighty. So again, good afternoon, everyone. Thank you so much for your participation and attendance at today's Regional One Health 2025 Disparity Study Community Meeting. So a little bit about Griffin and Strong before we get started today. So Griffin and Strong is a law and public policy consulting firm that specifically specializes in procurement research, training, and supplier diversity consulting, contract compliance, as well as program development. We are the most qualified team in the industry. Our team is made up of 6 JDs, 2 PhDs in economics, a PhD in social psychology, and we also have a PhD in anthropology. To give an overview of the objective of this disparity study, basically we are wanting to determine if there is a disparity between the percentage of qualified small, disadvantaged, minority-owned, and women-owned businesses that are willing and able to provide goods or services to Regional One Health, and that's being compared to the percentage of dollars that Regional One Health has spent with those such firms. Disparity studies also utilize the acquisition of anecdotal evidence like our meeting today, and we also examine current policy procedures and practices as well as conduct a case law review. Ultimately, the findings of the disparity study result in recommendations that are made by the Griffin and Strong study team, and if those recommendations are accepted, the intention is that they would be implemented as policy. So an overview of the study process and all of the elements that go into our disparity study. Again, we start with our legal analysis, looking at case law and relevant court cases in the circuit courts, and that are the foundational cases for disparity studies. We also have our purchasing policies and procedures process, which looks at all of the purchasing and procurement policies that Regional One Health has outlined. We then go into the largest section of our disparity study, which is our data. So first we start by collecting and cleaning all of the data that we collect from Regional One Health. And then after that, we move into our actual data analyses, first starting with determining the relevant market, going into the utilization analyses, the availability analysis, and then the comparison of utilization and availability, which results in our disparity indices or analysis. We also look at a marketplace or conduct a marketplace disparities analysis, which looks at private sector as well as public sector procurement opportunities. We also have our anecdotal evidence collection analysis, again with events like today, where we will be collecting qualitative evidence from firms such as yourself. And then again, our final report ends up with recommendations that the study team makes to our client, Regional One Health. So again, the anecdotal process is very extensive for our study, so we want as many of you to be involved and get involved in the study as possible. So of course, be vocal, participate in today's meeting. We also have a survey of business owners that is currently up. I will post that link in the chat so that if you have not completed the survey of business owners, you can follow that link and complete it. It takes about 5 to 10 minutes. And if you have completed it, if you would like to spread the word to any other firms or anyone in your network who may like to participate as well, that link will be in the chat for you. Of course, participating in an interview. We have anecdotal interviews that have already completed. So we have upcoming focus group sessions that'll be in the 3rd week of February. Those are not open to the public like this session is, but if you are contacted from the random sample to participate in a focus group, we do ask that you participate there. Of course, attending today's community meeting session, which you all are doing. And then you can keep up with study updates by visiting the study website, which is rohdisparitystudy.com. And you can also send comments to the study's designated email, which is rohdisparitystudy@gspclaw.com. I monitor that email address. So if you have any questions, you can direct them there, and I'll be happy to answer them. This is just a page to connect with us. We do have a Facebook, a Twitter, and a website. I also have repasted again here the study email and study website in case anyone did not get it from the previous slide. Okay. And so this is the slide that shows how we will be conducting today's virtual community meeting. So we have four major parts of this community meeting. First is the purpose of the meeting itself, which is to hear your candid testimony about your experiences, whether they be positive or areas of concern, either doing business or attempting to do business with Regional One Health. And even if you have not attempted to do business or have done business with Regional One Health, why haven't you? That's also some testimony that you could share as well. I do want to note a disclaimer that everything said during this meeting will be available for public record, but Griffin and Strong's final report does not publish any names, business names, or any other affiliations of individuals who provide testimony in today's session. So the process of today's meeting is that Griffin and Strong will not be soliciting questions, but only commentary. We will not be responding to any questions or commentary other than to try and gain additional clarity of any comments that you might make. And then when you are providing comments, if you will please begin by stating your name and your business name clearly before you start giving your testimony. So that is all the presentation that I have today. So now, like I mentioned, I will be turning it over to you guys. You can either start by raising your hand using the raise hand function to be called on, or simply unmuting and starting to provide your comments, starting with your name and business name. Is there anyone who would be interested in speaking first to share their testimony about their experiences either doing business or attempting to do business with Regional One Health? Okay, yes. Michael McKinney, if you would like to go first.
Good afternoon, everyone. My name is Michael McKinney. I'm the owner of Mobile Drug Testing and DNA Paternity. We've been in business over 15 years here in Memphis. Tried to do business with Regional One about 2 years ago. So we sent all the paperwork in to procurement, tried to get on the vendors list, never got anywhere. So I did get introduced by the telephone with a lab manager named Raj, and he was to oversee the process, but he was always too busy, in and out of meetings, never returning calls. So we just gave up. So have not had a good chance of getting on the vendors list with Regional One. And also the administration is always too busy or too important to return phone calls. So it's a major issue for me trying to get in the door to do testing.
Thank you for sharing, Michael. Is there anyone else who would like to share? You have similar experiences to Mr. McKinney, differing experiences, or just want to provide any information about your experiences, whether they be positive or areas of concern that you've had in your attempts to do business with Regional One Health?
I'm Calvin King. Can you hear me?
Yes, sir, we can.
Okay, Immaculate Facility Services. This is the same thing that Mr. McKinney experienced, getting the vendors list, and then even this year, trying to go back to get the vendors list, get on the vendor list, and all the hoops that you have to jump through, get all your shots and everything, even before you just to get on the vendors list. I mean, really, it's just, you know, it seems like it's a flag. It's like you gotta jump through all these hoops, and just to get your name on the list. I mean, you gotta get all these shots just to get on the list. I'm not even talking about going into the hospital or doing anything like this, but it's like it's just one thing after another. And from a couple of years ago up until now, it does not seem like things have changed. That's just my experience. Thank you.
Thank you for sharing, Mr. King.
Good morning. This is Barbara Knight with Resource Management Staffing Group, and my experience is pretty much the same. We did bid on a temporary staffing contract probably last year or year before, and got a chance to interview with some of the representatives out of HR, but the meeting itself, it was apparent to me when we started that they weren't interested in really doing business with us. The individuals were very cold and not really paying attention. The head lady, and I won't call the name, but that was on the call. It seems like she was looking at emails or I don't know, doing something else on the computer, was distracted. So I left the meeting feeling like it was a waste of time, and never got a response, never got a yes or a no, even after following up several times. Never was told that we weren't selected. So I assume that's where it ended up, because I never heard anything from them. So that's my experience. Thank you.
Thank you very much for sharing that, Ms. Knight. Yes, Miss Gail Jones Carson.
Okay, I've not had an opportunity to try to do business with the regional mayor, but I am curious as to know, do we have any data on the percentages of not minorities, but Blacks who do business with the regional mayor? Do we have the dollars that they spend in the Black community or with Black businesses? Do we have any of that data at all?
So this is not the forum for me to answer questions, but I will say that will be the result of the disparity study. As I mentioned, we do a full data analysis where that information will be completed once the disparity study has finished, which does not occur until later on this year.
So we have nothing on the nothing to compare to, nothing from the beginning to, we have nothing.
I'm not sure what you're asking for.
So we don't have any data to date. I know that you're trying to find out from folks right now,
Mm-hmm.
but there should be some data somewhere on the business that they do in the Black community. And I'm not saying minority intentionally, I'm saying Black.
Yes, ma'am, I understand. And that information is the result of the disparity study.
Okay, you're not getting it. Okay.
No. Hannah, this is Dottie Summerfield. I'm sorry, I can't figure out how to raise my hand. I own Summerfield Associates, a local recruiting and consulting firm similar to Barbara's. And my
Okay.
experience has been attempting to become a vendor, pretty much what everyone else has said, and it's ridiculous. It is not easy to even get through the process of applying to be a vendor. And I have a question, and I know that you can't answer this. And I'm going to go ahead and throw this one over for everybody on the call right now. And it's not the time and the place, but I would like an answer as quickly as possible. In the light of the current political situation, why are we even having this meeting? Gail, and that's for all of us, women-owned, minority-owned, DBE, Black-owned
I
businesses.
agree with the the question, I think this started before these latest incidents came about.
True. But are we gonna come up with something that's gonna be even viable if a disparity study comes out, is I guess the question. And that's probably not for a discussion around now, but I think it's something it's in all of our minds right now on this call.
Thank you for sharing your comments, Dottie.
Well, I agree. I understand what she's saying, but I still agree with the study that we need to know definitely where this organization, which is a large part of this community, where they are and giving back to folks who create business for them, lots of business for them.
Thank you for that comment, Kale. Alrighty. Does anyone else want to share again their experiences? Oh, Mr. David Sink.
Yes, I do. My name is David Sink. I'm the executive director of the Mechanical Contractors Association. This may be relevant to what some of the rest of you are talking about, but uh, the county sets goals for minority businesses, MWBE, to be used on projects. Now, in the case of construction, which is where I'm involved, a construction project is normally in the range of 20 to 30% of it is done by a mechanical contractor. Now, a general contractor could easily fulfill their portion of that job by utilizing a minority mechanical contractor to do the work, which in the case of construction, you're talking uh, hundreds of thousands of dollars per project. And that may be why they're less interested in the other portions of the economy. I don't know that to be a fact, but I'm just going to throw that out. In the case of a hospital, like we're talking about here with uh, building a new project, the figure for the mechanical portion of the job jumps to about 40%. So I think you can see what the impact would be on a large project. So I'm just throwing that out there. I don't know if that's an answer to it, but it may very well be. That concludes my comments.
Thank you, Mr. Sink. Okay, so to get back to learning about your or hearing your testimony about your experiences doing business or attempting to do business with Regional One Health. We've had some comments earlier. Are there any positive comments, areas of concern that anyone would like to share either in their experiences doing business and working with Regional One Health, trying to do business with Regional One Health, or if you have not attempted, why haven't you?
This is David Sink again. I've just got one more question to ask, and that is, will there be one of these segments where we can ask questions?
So there was the informational meeting that was held at the end of last year, which had a Q&A portion at the end of that session, which we attended to present to the public and to answer any questions. So the purpose of this session is to just gather anecdotal evidence, qualitative evidence for the purpose of our anecdotal chapter of the study. And then there may be presentations at the end, depending on the client's preferences, for any other public presentations. For those who have not, oh, let's see. Okay, Sandra, I see your comment in the chat. Would you like to unmute and share your testimony about having success in conducting business with Regional One Health?
Yes, hi. Thank you, Hannah. Hello, everyone on the call. My name is Miss Sandra Williams, and I kind of just hopped on. I do apologize. Had some students in my office, but I do work with Concord College. I didn't know if this session was about a college, so but I did want to provide positive feedback. We're working with the HR reps in various departments in Regional One with the success in promoting our graduates for hiring there. So it's been a smooth, nice process. One of the bigger ones is doing a pharmacy tech. And I think that the young man that I work with, and I'm sorry, I can't think his name right now, Mr. Ben Veskler. He is a great person to work with. So as far as like career fairs, they always here at present here at the campus. We have 3 times a year. And Regional One is always one of the ones that are willing to come out, and they bring multiple departments with them. And most of them are just a phone call away with the HR reps. I'm able to, like when you all had a career fair at the Benjamin Hooks Library. This was like maybe 4 months ago. I did get an invite to have a table there. I just wanted to be present with Regional One and show my support because it was open to the public, but I also had graduates that wanted opportunities with the company. This is the way I was able to, help facilitate any questions they may have. And just being present with Regional One is just having a table at the career fairs was kind of phenomenal.
Great. Thanks so much, Sandra, for sharing that. Would anyone else like to share their testimony? It could either be similar to those that were shared by Mr. Michael and Calvin and Barbara at the beginning of the session with their issues trying to get on the vendor list and be able to do work with Regional One, or it could be a different experience that you may have. Okay. Well, we do have quite a bit of people on the call who have not had a chance to unmute and participate. So, if you would like to go around for those who have not unmuted and shared at today's session, and just unmute and share your name and your business name, for the record, we can do that as well.
This is Catherine Knapp. I'll speak up.
Okay.
I worked for a hospital system before I left and stood up my own business doing franchise consulting. I do that still, guiding people through the research process. But I also became a franchisee with setting up business networking groups. And my members are all business owners or representatives of businesses that in some cases could provide services to maybe to the entire Region One organization. And then some could provide some sort of niche service that might be useful to either some groupings of patients, some employees, and so on. So how much interaction does the hospital system have with smaller businesses or mid-sized businesses?
Thank you. I'm taking your note.
And if there is a way to open that door, what would that avenue be? Because I would want to um, get my networking groups educated up on that.
Okay. Thank you very much, Catherine.
You bet. Thank you.
Can I answer Barbara? I mean, Gail. Gail, I did a little bit of research on the question you asked about minority spend,
Oh, great.
and multitasking is a wonderful thing. And if I'm out of line, please tell me. Between fiscal year 2013 and fiscal year 2022, Regional One Health's total diversity spend was 83.3 million, with 72% spent with minority and women-owned businesses. The total spent with those was 59.7 million.
Mhm.
Regional Health percent of diversity eligible spend was 13.6 of its budget in 2022. And it's only breaking down with minority and women-owned 7.5 million in 2022. And that's the latest I could find. But so it's
So they don't break it down any further.
no, and
I mean, regarding like, Blacks, Latinos, females, any other races,
and I'm not sure if they're
and
using
disabilities or whatever.
right. And Gail, I don't know if they're using the county's way of certification, because the county designates a WBE, a woman-owned business, as a white woman-owned business,
Mhm.
and both all of the minorities go under the MBE. So I don't know. And the other question, it mentions disadvantaged business, but truthfully, I guess I can ask this, Hannah. Will Regional One do reciprocal certification as many of the other organizations are starting to do? And will they take the DBE, the Disadvantaged Business Enterprise? That is another question.
So, Dottie,
Yes. Hey,
Uh,
Joselle.
hey, Hannah, if I may,
Yes, ma'am.
I'm Joselle Booker, President and CEO here at the MMBC Continuum. And we're working with Griffin and Strong as they are implementing this disparity study. As Hannah stated, this is a community meeting, and the purpose of this meeting is to hear negative, positive, indifferent testimony from individuals that have done business or attempted to do business with Shelby County government. Much of the information, the question that you had, Gail, will come after. That's the purpose for the study. The purpose for the study is to have an independent entity to come in and examine Regional One's health purchasing, contracting behaviors and the things that they've done, and then analyze all of that information and then put forth a recommendation. So what you're asking specifically for is, as Hannah said, is the outcome of it. They're collecting data now, they have data, they're analyzing it, but they don't have anything that they can share. And this meeting is only to take testimony, not answer questions. And I think, Hannah, there was the first meeting that was held some time ago was the meeting where people could ask questions. And so this is where we are in the process. She's not being evasive or not trying to answer your questions, but they just have a process and a methodology as to how they present these studies. And so once the study is done, they present the findings, they present, Dottie, at that point, there'll be recommendations as to how or what they would be, they could implement. And so I just wanted everybody to just be a little tolerant as they work through their process and methodology. Unfortunately, some of the answers that you all are seeking, they haven't gotten to that point yet, but they'll have all of that information. And then once it's presented, they can answer all the questions, because Regional One Health has never conducted a disparity study, and this is the first time where, you know, that'll be conducted. So Hannah, I just
So
wanted to hop
Josie,
in and
I understand what you're saying and I understand the objective of this meeting, but I still had the questions and I know that somebody knows the data, whether they have it or not.
yeah,
Somebody
but
knows.
they probably do. Dottie got it from somewhere. But it wasn't a result of a study, but the data and information is coming based on how they have put together their methodology and how they prepare this. But
Okay, so
it's
you
coming in full
said that we can,
transparency.
you
It's coming.
initially said that we could ask questions and they didn't tell me what I couldn't ask questions on. But I do have another question. Number one, is the Regional Med a Shelby County organization? And if it is, and correct me if I'm wrong, a few years ago, it was outlawed that the county or any government, or maybe it was Shelby County Schools, that they could not do specific percentages of businesses with minorities. Is that true?
So as I did say in the process of this community meeting, which is shared on the screen, I will not be responding to any questions or commentary because that is just not the purpose of today's meeting, as Joselle spoke about as well. So I am just going to kick it back to the main purpose of this meeting, which is to garner testimony from business owners' experiences, either attempting to do business with Regional One or working with them, or why they have not attempted to do so.
And Joselle, thank you. And I apologize if I stepped out of line by throwing in some data that I found online. So thank you very much.
Well, I thank you for sharing it.
You're welcome, Kate.
And since I'm not a business owner, I've not tried to do business with the Regional Med, so I probably need to get off the call.
Thank you for your attendance. Okay, just monitoring the chat for a moment. Okay. Alrighty, is there anyone who would like to, oh, let me see. Again, Sandra, I'm not sure. But I can take your note. Would anyone like to share their experiences again, their testimony, whether it be positive, negative, indifferent, as Ms. Booker stated, in your attempts to either do business or having worked with Regional One Health, or if you have not, what have been kind of your reasonings for not?
Yes, how you doing this afternoon, Hannah, and everyone on the call? This is Calvin Nams with Immaculate Facility Services. And as we were started the process to try to do business with Regional one of the things that I discovered is as you go to Regional One website, there's no clear roadmap on even how to register your business or to do business with Regional One. So that took like a 2-week process to get in contact with someone. And then once we did make contact, we come to find out that there's a third-party vendor that handles that process. And there was misinformation as well on the what the cost is to even register via that third party. And at this point, now that the fees have been paid, well, it's additional information that also has to be provided by the prospect business. So that's one of the main things that I noticed just within the registration process. The website is not conducive like most other government websites or corporate websites to show you how to do business and even to register with the entity to do business. So I do think that's one small step that could be changed sort of quick, just so it's welcome to businesses.
Thank you very much for sharing that, Calvin. Would anyone like to kind of piggyback off of the comments that Mr. Nelms just made, or any other comments that have been made throughout the session? Okay. Again, I'll go back to there being quite a few people on the call who have not unmuted and shared their experiences or testimony. So for the purposes of our record, if you would like to unmute and just simply introduce yourself with your name and your business. And if not, I can start calling on people as I see them on the side of my screen over here. We'll start with Miss Rhonda Lyons.
Hi, I was actually typing it in. Rhonda Lyons, Weaving Financial. I have not attempted to do business with Regional One, but I would like to in the future.
Thank you very much for sharing that. Participant Michelle Elrod.
Hello, my name is Michelle, and I am with the Covington-Tipton County Chamber of Commerce. As far as I know, we have not attempted to do business with Regional One, but we are certainly open to that possibility if the opportunity arises for anything in the future.
Thank you very much. Jimmy Tucker.
Yes, good afternoon, everyone. I'm Jimmy Tucker with Self Tucker Architects. We have done some business with Regional One, but we're certainly interested in doing more business, and we're trying to position ourselves to participate in the new hospital project. And just one question for the record, Hannah. I was curious to know when the disparity study might be published. Is that some information that's actually on the Griffin and Strong website?
I can't remember if the timeline is clearly laid out on the website, like a month by month thing, but we are looking to complete this disparity study in August of 2025.
Okay, all right, thank you.
You're welcome. Was there, before I move on, Jimmy, was there anything that you wanted to share about your testimony or experience since you have done business with Regional One Health in the past?
Well, I would just say we really have not had any negative experiences, but we feel like we have not been able to get the opportunities to work based on our capacity as a business. So that's kind of our main concern, to understand the outcome of the disparity study and see how that might inform our approach to Regional One going forward.
Okay, thank you very much. Okay, participant Brenda Fortney.
Hi there, I'm Brenda Fortney and I'm with Case Medical. We are a medical device manufacturer, and we are a nationally certified women-owned small business. I apologize, I am new to a role with Case, although I've been with the company for many years. And this invitation was forwarded to me, so I was not able to participate in the original session, which sounds unfortunate because I do have quite a number of questions with regards to, how vendors are able to, start the process in working with Regional One. So it sounds like there's a lot of questions with regards to vendor registration and vendor credentials. And it sounds like there is a credentialing process that takes place before there is a vendor approval process. So that's a little confusing to me. And I also don't know if there are, forgive me because I don't have the background on what our past business transactions have been, but it sounds as though the process of getting started, I don't know if there are typically RFIs or RFPs that go out in order to solicit um, vendors of all, whatever the category is, because obviously there are some requirements there. So again, I apologize. I have a lot of questions, but I don't have a lot to contribute as far as actual experience. So thank
That's
you all
okay.
though who have.
That's okay. No need to apologize. Thank you for sharing that. And again, if anyone has any questions that would be pertaining to the disparity study itself, you would want to direct to Griffin and Strong, who is conducting the disparity study. Again, you can email ROH disparity study at gspclaw.com. I'll put that up on the screen now. You can send any comments or questions to the study's designated email. Again, rohdisparitystudy at gspclaw.com. Any questions that would be pertaining to a question that you had for Regional One Health about any of their practices and things like that, that could not be answered by Griffin and Strong, but it could be taken into account like this, a question that we bring up to Regional One that has been being asked throughout our anecdotal process. But if you have any questions, like Mr. Jimmy had about, the study's duration or when it's being completed or anything to do with the disparity study itself, you can direct those comments and questions there.
This is Catherine again. When the answers are determined, will they be broadcast to everybody who attended?
So the questions that you're saying to, like, if they were to pertain to Regional One Health?
Right. Any questions that were asked, but and the question was just noted but not answered. As the answers are determined, will the questions and answers be distributed to the people who registered?
That will be something that will be taken care of on Regional One Health's side. Griffin and Strong, like I said, we would just be taking these notes down for the record, like Joselle mentioned, and we can communicate that to Regional One Health that that's questions that are coming up. But Regional One or Griffin and Strong is not in the position to answer questions for Regional One. We could only answer questions about the disparity study that we're conducting.
Okay, thanks.
Of course. Okay. Steve Werner, if you would like to unmute and introduce yourself.
Yes, I'm Steve Werner with Gresham Smith. We're an architectural and engineering firm. We have worked with Regional One in the past and have had a great experience. The primary reason for my attendance is just to listen to the community and see if there's anything that might inform the design if we were lucky enough to work with them in the future.
Thank you very much. Was there anything specifically that you wanted to share about the positive experience that you've had with Regional One?
No, it's been a positive experience. We have not had the difficulties some of the others.
Okay. Thank you so much. Stephen Edwards.
Hello, my name is Stephen Edwards. I am representing Trek Design Group. Trek has not worked directly for Region 1 Health, and we're just interested in the process moving forward to be part of teams that are designing infrastructure for the hospital.
Thank you very much. Miss Nisha Powers.
Hi, yes, I'm with Powersville Design, and we are a civil engineering firm, and we have not attempted to do any work with Regional One, and therefore have not done any work with Regional One so far.
Okay. Was there anything you would like to share about your specific reasonings for having not attempted to do work with Regional One?
I don't think I have anything specific to share. There hasn't necessarily been something on my radar that got my attention, but I think there is a project upcoming that Jimmy and others have referred to that we'd be interested in as well.
Okay, thank you very much. Participant Stephanie Jones White.
Hello, I'm with the West Memphis Chamber of Commerce. I recently joined last January. So to date, I'm not aware of any work that we have done with the Regional One project.
Okay, thank you very much for sharing. And then finally, participant Janice Garner. Janice, if you're speaking, we aren't able to hear you. You can always leave it in the chat as well. Okay, now that we have had the opportunity to let everyone introduce themselves and give testimony and any information about if they have participated or been able to do business with Regional One Health or not, is there any other comments or testimony that anyone else would like to make during this community meeting? In the meantime, I am going to stop sharing my screen so that I can grab some links for you all to place in the chat. So the first link that I just sent in the chat is the Regional One Health Disparity Studies survey of business owners that I mentioned earlier. Again, that survey does support our anecdotal analysis. It also provides data for other parts of our disparity study as well. Again, it only takes about 5 to 10 minutes to complete. It asks some, demographic questions and things like that, but it's also an opportunity to provide any comments or answers to anything that you would provide in an anecdotal format in more of a multiple choice response format so that we can quantify your experiences of your business. So if you would like to take that survey, it will be posted for, I believe, another 2 weeks before that will come down. So if you are interested in completing that, the survey is in the link or in the chat. And then I've also just put the email, the study's designated email, where I mentioned you could send any questions or comments that you had. And then there's also a link to the study website, which has some information about the disparity study. There's a place for question and answers on there as well, a little bit more information about Griffin and Strong and the study team, as well as that is where we post and keep updates for any events that we have coming up pertaining to the disparity study. Alrighty, so with that being said, I do think we've come to the end of you guys providing any testimony and comments for today's community meeting. Again, I do appreciate very much for you attending this afternoon and sharing your experiences, and it was nice to meet you all. I will stay on for a further 5 minutes until 2 p.m. in case there's anyone else who wants to provide any comments or testimony. But otherwise, I thank you all for your participation, and I hope you have a great rest of your day and great rest of your week. Thank you very much. For those who have stayed on, are there any other comments or testimony that you would like to provide?
Yeah, Hannah, this is Jimmy Tucker. I was just curious to know, we're expecting that an RFP or RFQ will be issued regarding the new hospital project. Do you happen to know, and hopefully this is a question you can't answer today, but if that will be issued, the RFP or RFQ will be issued after the disparity study will be completed?
So unfortunately, Jimmy, I'm sorry, I don't have an answer to that question. I'm not sure when Regional Health is going through that process or when that would be issued, and how that would be kind of related to the disparity studies timeline. I apologize.
Okay, no problem. All right, thanks. I appreciate it.
Of course, have a great rest of your day.
Yeah, you too.
Steve, was there any other comments that you wanted to make for today's community meeting?
No, thank you.
Okay. And then Rhonda. Oh, okay. Janice, I know you were not able to unmute and participate earlier. Are you able to hear me now?
I am. Mm-hmm.
Okay, great. I called earlier for you to introduce yourself and if you wanted to make any comments or share any testimony today.
The introduction, Janice Garner with Bluff City Parties and Events.
Okay.
And we are event planners that specialize in engagement with through fun. I think we've had we've done a couple activities with Regional One, like with their employee days and stuff like that, but we are more along the line of trying to figure out our way into the different organizations and stuff like that, because what we do is not necessarily, it's clearly defined as some other areas.
Okay. All righty. Thank you very much.
You're welcome.
Alrighty, I will stay on again for one more minute until 2 p.m. Janice, if there's anything else you wanted to share. Otherwise, I will go ahead and end today's session. And thank you very much for your attendance. Alrighty. Again, thanks very much. If you have any questions or comments, you can send them to the disparity study email address. But otherwise, have a great rest of your week. Bye-bye.